Thanks so much. Our next speaker is Cambon-Thomsen, representing the plan France Médecine Génomique. Anne's background is an immunogeneticist, but it seemed to me, looking through your background, that you've had a huge focus in terms of health ethics, particularly across Europe and also within the French genomic medicine program. So we look forward to hearing about what's happening in France.
Thank you very much for your introduction and for having the possibility to talk about this genomic medicine plan in France, which is coordinated by the alliance of all institutions taking care of life sciences and health. And you have a list of incredible acronyms at the bottom of the sessions of the slide. My role in this plan is in the ethical, regulatory and societal aspects. So there may be a number of questions which will be more technical, where I might not be the right person to answer. So it all started in 2015, not the sequencing in France, but the plan itself, by a letter from the Prime Minister to the head of the Alliance and the CEO of INSERM, Yves Lévy. And we had to, over a year or a bit more, to explore what's going on, what are the possibilities, and to construct the basis of a plan. And there was still the question of, will this plan be accepted, become something concrete or not? And in June 2016, there was the announcement by the Prime Minister and the Ministry of Health that this plan would actually be endorsed, organized, and put in place. So that had been quite a number of people working on that. And what is the ambition of this plan? It's all turned to clinical care first, which is embedding the sequencing in the French clinical care and healthcare system. So it's not going from research to clinical care, it's being implemented directly in the clinical care system, and little by little, obviously. So I'm not going to describe in detail all these different slides, but I think the spirit is this. And it's not one platform, it will be a federation of different platforms over the territory. And of course, the idea is that getting all this data from clinical care, sequencing, and with the clinical data, there must be branched on that a number of research projects, and there are some pilot projects we start with. I will come back to that. So the plan is organized with three major objectives, which are set in this slide. Set up the tools for a genomic healthcare pathway, ensure the development in a safe technical and ethical framework, and implement monitoring and management tools for this to be sustainable over the long term. And this is declined in 14 different actions. So I have introduced that as today and tomorrow where we are now. These 14 actions have all been started, and they are at different stage of development. I will go quickly through them. And of course, it's not an isolation of France, but it will be, of course, once really started, which is actually happening now, very important to exchange with other projects, and there has been already quite a number of conversations and exchanges with Genomics in England. So where we are now, these different platforms are being developed, and 2 of them are going to start. They are going to start in Paris and in Lyon in beginning of 2019. There has been a call last year or end of 2016 or 2017. There have been a number of projects and 2 have been selected. The rest will follow. So platform all over the territory, 2 of them starting. The Center of Analysis of the Data, the CAD, will be a centralized structure where the most important and in-depth genomic analysis will happen. And this CAD is thought as a delivery, the place for the delivery of services, both for patients, for industry, and for research. And the different actions, I mentioned 14 actions in the beginning, are listed in relation to this implementation, monitoring and management on this slide. I've put in blue the place where I am actually active in the plan, which is in organizing information to the public and the ethics part, which was mentioned on the slide before. The action 14, so that's the last one, is governance. So I start with that one, because now this is in place. It took some time with change of government and this kind of slightly complicated aspects. We have an interministerial steering committee, so at the top level, under the Prime Ministry responsibility, which oversees the goal of the plan and its development. It meets 1 or twice a year. We have a monitoring committee where all the institutions and different ministries involved are represented, and they meet every 3 months. And then we have an operational committee where we have the responsible of all the working groups of the different actions that meet once a month, just to give you an idea. So these are the different working groups that have been put in place related to platform, to the Center of Analysis, to the Center of Reference and Excellence, and this graphics is the one which is the most related to what was discussed in the previous session with the standards and this aspect of the GA4-GH development, obviously. Then there are the clinical pillar, where we have 4 different pilot projects, and 2 of them are operationally starting right now and in the beginning of 2019. I will come back to that. There is one in cancer, one in intellectual disability, and so rare disease oriented, one in diabetes, so more on common disease, the rare in the common, as you just mentioned before, and one on the population level, which is maybe this population-based frequencies and variants that can be shared in such a community like GA4-GH. A whole group is working on clinical indications, and of course this will evolve over time when knowledge is developing. So this is also something that can be shared with GA4-GH groups in all different other national initiatives. And then we have the ethics, regulatory, societal aspect, and medico-economics to mention the most active ones. So the 2 platforms I mentioned before, one is called Sequoia, that's the Paris one, and the other one is called Oragen, that's the Lyon ones. So they have been over a year developing all their bases, and one of the things is that they start before the central analysis the Center for Central Analysis is actually completely set up. So there will be, in the beginning of the plan, a number of analyses done and relying on the local capabilities, and that was part of the criteria for selecting the platforms. Each platform is set up to accommodate 18,000 genomes a year. So that means that when we have the 12th platform, it will be around 200,000 genome a year. The Center of Reference Innovation, Expertise and Transfer, which is summarized in the graphics, has actually a number of very important aspects regarding sequencing, regarding the different category of tissues that will be treated, regarding the software and the informatics. And I think really this graphics is something that should be shared and worked together with the GA4-GH standards and maybe contribute to them. So the CAD, this Central Analyzer of Data, which is being set up for the moment, is seen as a delivery system for services. So they get the data from the different platforms and they deliver a number of services. I mentioned already that to industry, to research, and of course to patients and the centers, the different healthcare centers all over France. So that's where the link with the research will be actually being done. We do not construct a central biobank. It's really the data that will be centralized. The samples will be kept on site. So these are these different services. This is the full activity for the moment to set up this. There are a number of legal aspects to respect, specifically as all the data are concerned, both clinical and genetic or genomic data. The portal is being defined for the moment and will be, the whole system will be as a sort of orchestrator of what can be done, access to the data, and this is also in relation to the GA4-GH, a number of aspects. That's where the access to the data will be defined and practically done. The ethics, regulatory aspect, and society. That's the group where I am a co-leader with somebody from the Ministry of Health. We have worked on a common patient information and consent form for the whole plan, and we are in a specific situation in France where genetics is completely regulated by the bioethics law. And this bioethics law is under revision regularly, but this is happening now. There was a public consultation in the first part of the year 2018, and the different reports, and the parliamentary debate will occur in the first part of 2019. So we have developed consent forms under the current law, and we know that in about 6 to 8 months we will have to modify it to fit with the new elements. Data protection, of course, there is the implementation of the GDPR. Human and social science have been present, financed for the moment, but present in the plans in the beginning. And the idea is on the pilot project to branch observation studies and social science studies. And that's where we have next month, the 5th of November precisely, a meeting with Genomics England, equivalent part of the project, and we hope to have some good exchanges there. I will just... So what is in this consent? Maybe nothing surprising, but we had to go through rather precisely. Consent forms have been defined and revised by this group for the 4 pilot projects that qualify under research, clinical research, rather than the new consent form is for clinical care with openness to research. The elements in this form are, in terms of information, the usual things about the indication, the technical aspect, but also the consequences for family. And in the French law, there is an obligation for patients to manage in such a way that useful information for family members is brought to them. So in this consent form, there is this specific aspect that they have to define the modalities and to choose between different modalities for that. And there is a specific part for opening to research. So to summarize, now, right now, the start of the 2 platforms, Sequoia and Oragen, beginning of 2019. In terms of pilot projects, the cancer and the intellectual deficiency are starting at the same time. We will pilot at the same time our consent form and information, knowing that we have 6 months then to modify it. I already mentioned that. And I think that now that we come to concrete aspects, it's a good time for France and this plan to think about being more active in GA4GH. That's actually a good sign that I've been asked to talk about it in this audience. Okay, I think I will stop there. I had 2 slides on the different cancer and intellectual deficiency project, but I think that I can answer the question more specifically.